So our next speaker, I'm delighted to invite Dr. Sylvia Huang, who some of you already met at the caregiver breakout session. She's going to talk about emotional and cognitive changes in ECD. She's an associate professor and clinical psychologist at UAB and a great partner in caring for these complex cases and other cancers as well. And we are looking forward to hear from her about a topic that we hear a lot about from our patients and see what she has to offer.
Oh, I'm short. Good afternoon, everyone. I'm Sylvia Huang. I'm a human being. I'm a daughter. I'm a caregiver and a clinical psychologist who learned so much from all the patients and loved ones over the years. So today I'm going to share with you emotional and cognitive changes in ECD. So let's first get this started, why this matters. Okay, I think I already kind of revealed the answers up front. So over half of ECD patients report emotional and cognitive changes, over half. And it actually happens across time. It can happen even when the disease is stable or even in remission. So it's like, wow, it's not only a one-time symptom. I want to spend some time here talking more specifically about the emotional and psychological symptoms commonly experienced among ECD patients. Of course, these are kind of almost like a cluster of emotional burden or symptoms that patients suffering from a tremendous array of physical symptoms commonly experience. So I like to frame this as, you might be surprised, okay? As a clinical psychologist, I'm gonna tell you sometimes it's normal reactions to abnormal circumstances. Normal reactions to abnormal circumstances or conditions, because what they're experiencing is really very unique and very challenging. So one thing, I think the first thing to start as we cover those symptoms, I want to do one thing is this stigmatization, okay? Because a lot of people who are struggling with emotional symptoms inevitably feel vulnerable or feel less. And I wanted to let you know that as human beings, every time when I'm sick, I feel I want to cry because I feel so uncomfortable and I feel scared and terrified. And it's not always, I would say, the bad thing to experience how you really feel. So I do know that sometimes we categorize those emotions or experiences as symptoms, but to begin with, I want to share with you that let's first of all acknowledge that these emotions are real. Okay? And they are not like something like, oh, I have done something wrong, I am not doing enough, I'm not trying harder. Okay, so let's start with depression, which is actually very common. The lifetime prevalence rate for depression observed in ECD patients, according to the literature, is 80%, which means that at any time point, once you are diagnosed with ECD, you are likely to experience depressive symptoms. And over 50% of patients experience ongoing symptoms. It's not like, okay, one time, ongoing depressive symptoms. And when you are depressed, a lot of times it's correlated. Okay, we call comorbid or co-occurring symptoms with anxiety. Okay, 30 to 50% of patients experience heightened anxiety and constant worry. And so that may interfere with their day-to-day functioning, of course. And over 50 to 70% of patients experience tremendous amount of what we call emotional distress. So distress in cancer world is I will call it a wonderful neutral term because it's not associated with any, pathological, definition. It's just distress. It can range from feeling very overwhelmed, lost, not knowing what to do, to even more severe symptom burden in terms of psychological suffering. And irritability, when you are fatigued and tired, okay, it didn't take much to feel snappy. Okay, I have a patient told me yesterday, like, my goodness, it didn't take much, this much, okay, I feel irritable. Because I would say when we go through tremendous amount of physical suffering plus emotional suffering, our capacity to process emotions and also work around we call emotional distress tolerance level is compromised. Okay, we may not have the bandwidth to process a lot of things, so we can get short quicker. A lot of people during our caregiver breakout session also talk about their loved ones struggling with denial or shutdown. Okay, and sometimes people see that, oh, you look fine from the upfront, like from the outlook, you look okay. From the appearance, you look okay. But deep inside, they kind of checked out. Okay, and that may interfere with their engagement with work, with relationship, with family life. So with loss of motivation, loss of interest in doing things. Of course, we also observe emotional liability. Sometimes very quick, rapid changes between feeling okay and not feeling okay. And so overall, I would say combined together, up to 70 to 90% of patients experience either any one of the symptoms or combined, and often they come in with clusters. And before I kind of wrap up this slide, there's one thing I haven't included in this because the literature haven't really studied or investigate enough on this, but we commonly observe that in cancer patients, okay? And I'm gonna share that with you. So it's called cancer-related post-traumatic stress symptoms. A lot of patients and families, after dealing with day-to-day symptom burden and suffering, when going through numerous scans and even surgeries and doctor's appointments after doctor's appointment, sometimes it's very common for people to feel burnt out. Just burnt out by going through so many appointments. And also, a lot of times people feel like they are traumatized by either the diagnosis, the treatment process, or the treatment side effects. So in my clinic sessions, when we sit down, sometimes the referral reason is depression or anxiety. But when we drill down, it's because they have been almost like veterans on the battleground, 24/7 nonstop bullets or bombing happening. They got so overwhelmed and they developed this kind of traumatic stress symptoms. And as a clinical psychologist, I personally, my preference is not to call this PTSD disorder, because when we say it's disorder, people feel like I'm the one to blame, something's wrong with me. I prefer to go with the Canadian version, okay? So in Canada, they do not use PTSD as often. They call the combat veterans, the symptoms they suffer from traumatic stress, they call it occupational injury. Does that make sense? Like, nobody signed up to be being kind of shot all the time from different angles. And so I think that kind of normalized that experience. It's not their fault. So I personally prefer to call it cancer-related, I would say, injuries, okay, or post-traumatic stress symptoms. And also the data shows that very rarely people have met the full-blown criteria for PTSD, but up to 80% of cancer patients and also caregivers, caregivers may be a different percentage, but patients experience post-traumatic stress symptoms. So in our clinic, we do evidence-based treatments for all of the symptoms and also for trauma-informed care. And I definitely see a huge difference when we incorporate the trauma-informed care into patient interventions that truly can drive a profound difference. Okay, so I'm gonna move on to talk about a little bit about, like we talk about the emotional aspects, and I'm gonna talk about cognitive changes. So similar to emotional symptoms, cognitive changes are also very, very common. So very quickly, global cognitive impairment across domain are very, very commonly observed. So over 50% to 70% of patients we can identify noticeable cognitive impairment or changes during their ECD journey. And also, it's strongly associated with central nervous system involvement, which happens. So this is another slide talking about the different percentages and all that. But I think to summarize that, as you can see, suffering from ECD's physical symptoms and emotional symptoms can have a profound impact on our cognitive health. So our memory, whether it's working memory or verbal memory, got impact. Okay, it's over 50%, around 50%. Attention and focus is compromised, so you may have shorter attention span, or when you try to remember something, it's not registered. Okay, so that can a lot of people describe this symptoms very crippling, because if I can remember, what do I know what I need to do next? So it can create a lot of frustration. In addition to attention and focus challenges, processing speed also can slow down. Sometimes you ask a question or try to recall, it takes longer time to retrieve that information. And executive dysfunction is also compromised or impaired a lot of times. So in terms of even related to whether execution, planning, cognitive flexibility, or even inhibition. So some people say that why there's emotional liability? Because I would say the filter to filter through stuff to help us, process things in kind of in a rational way may be challenged. So therefore, the inhibition may not be as intact. So it has profound, I would say, influences. Last but not least, visual spatial processing can be impacted as well. So their balance or their kind of may not as intact because they cannot just coordinate very well. Personally, I'm born with poor visual spatial processing. I approach something, I bump into something. Okay, so I may bump into a glass door or something. So as you can see, all this combined. I would say that it's very important if we put ourselves in our loved ones' shoes. You will know that this is definitely compromising overall quality of life and overall day-to-day function. So it can profound tremendous, it can definitely impact tremendous challenges. So let me talk about why do these changes happen. So I think in the session before, talking about self-care strategies, we talk about mind and body, they go hand in hand. And if there's anything we can say from this, I want you to take home today, it's one word, it's one sentence. It's called, there's no health without mental health. There's no health without mental health. When our emotional, psychological, I would say, aspect curve is impact, we are having a hard time navigating. So of course, we know that these are the symptoms we describe have its own neurological and also medical basis, whether it's inflammation, hormonal changes, or physical stress. Okay, and also knowing that living with a long-term disease process, it's not like, okay, you have an end day, you can graduate from this. Ongoing, I would say living with a rare unpredictable disease also create what we call accumulated effects. So, for example, if you experience something stressful, it's a small s. But if you add it up, small s, or sometimes it's a bigger s, you add it up, it becomes overwhelming, and sometimes it can be unbearable. So I wanted to kind of share with you when you or your loved one experience these symptoms, it's very important to seek out supportive care and psychological oncological resources. Our approach is to promote overall quality of life, supports the whole family. So Dr. Goyo asked me, like, hey, do you provide caregiver sessions, individual sessions, not only just patient sessions? Yes, we do. Here at UAB, that's kind of no-brainer for us. Survivors has always, their symptom burden, their suffering always impact everyone in the family. So we want to be very family-centered as well. So in addition to your excellent oncological care, you need support care to be your buddies, okay, to be your best buddies. It provides an extra layer of support for everyone, and also it treats the whole person, the whole family. So to support that, we have an interdisciplinary team. So my colleagues, Lizzie and also Richard, they're gonna kind of join me as we wrap up. So some key takeaways. Please know that if you experience any of the symptoms or your loved ones experiencing any of those, you are not alone, and supportive care can help. Early detection, early intervention can make a huge change on your quality of life. And also, caregivers need care too, okay? So with that said, asking for help is not something kind of, okay, we are not good enough, we are not doing the right thing. It's part of your comprehensive cancer care. Okay. With that said, we're going to save the questions to the very end. And please forgive me, I'm a sleep-deprived caregiver too, so if communication may not be as clear, I lost train of thoughts at times. Please, I appreciate your kindness and patience, but we are here for each other. So thank you so much.